Could an oncologist save Steve Jobs from pancreatic cancer in 2025? Today, we'll look into a comparative analysis of treatments for his rare pancreatic neuroendocrine tumor, or pNET, from the early 2000s to the cutting-edge standards of 2025. Back in 2011, localized pNET had a 60% 5-year survival rate. Today, with optimal care, that's climbed to 85%. Let's explore how far we've come and what it might have meant for Jobs. Steve Jobs was diagnosed with a pNET in 2003, a rare malignancy, just 0.8 cases per 100,000. He delayed conventional treatment for 9 months, favoring alternative approaches before undergoing a Whipple procedure in 2004. By 2009, metastasis led to a liver transplant, and he passed away in 2011. For untreated metastatic pNET, median survival was just 2 to 3 years. His timeline sets the stage for our comparison. Jobs' initial choice of diet and acupuncture over surgery was a gamble. In 2011, the standard for pNET was the Whipple procedure, effective for localized disease, offering a 55 to 65% 5-year survival rate, or somatostatin analogs like octreotide for symptom relief. Targeted therapies and immunotherapy? They weren't even on the radar. His delay likely cost him critical time. By 2009, Jobs' cancer had spread to his liver, leading to a transplant, a bold but debated move for pNET. In 2011, transplants were rare for this disease, with recurrence risks amplified by immunosuppression. Median survival post-transplant hovered between 3 and 5 years. It bought him time, but not a cure. How would 2025 change this? In 2011, systemic options for pNET were limited. Streptozocin-based chemo and octreotide offered modest control, with metastatic patients facing a median survival of 24 to 36 months. No precision medicine, no immunotherapy. This was the landscape Jobs faced. Survival curves from that era tell a stark story of limited hope once the disease spread. Fast forward to 2025, early detection has transformed oncology. AI-driven imaging and circulating tumor DNA screening boast 90% sensitivity, catching pNET far sooner than the CTs and MRIs of 2003. Resectability has jumped from 20% in 2011 to 40% today. For Jobs, a 2003 diagnosis with 2025 tools might have shifted everything. Surgery in 2025 is a different game. Robotic-assisted Whipple procedures, guided by intraoperative molecular imaging, cut complication rates from 15% in 2004 to just 5%. For localized pNET, 5-year survival now reaches 80 to 90%. Imagine Jobs undergoing this in 2004. Less invasive, more precise, and a stronger foundation for adjuvant therapy. Systemic treatments in 2025 are a revolution. Immunotherapy, think anti-PD-1 combined with CAR-T, and targeted agents like sunitinib and everolimus deliver a 60% response rate for pNET, doubling 2011's 30%. Progression-free survival has stretched from 11 months to 24. For metastatic disease, this could have been Jobs' lifeline after 2009. Let's hypothesize. If Jobs were treated in 2025, early detection in 2003, a robotic Whipple, followed by immunotherapy and precision drugs, he might have delayed metastasis significantly. Even post-2009 recurrence could have been managed with CAR-T. We estimate a survival extension of 5 to 10 years, potentially living to 2016 or 2021. It's not a guarantee, but it's a leap from 2011. So could we save Steve Jobs in 2025? With early detection, advanced surgery, and personalized therapies, his odds would have doubled. But patient compliance remains the wild card. pNET mortality is projected to drop 25% by 2030, thanks to these innovations. The message for us as oncologists? Leverage precision oncology today. It's rewriting survival stories. Subscribe here and go to oncologytube.com for more on this and many other cancer research topics.